I am on the Autism Speaks website, and this is a cool tote handbag that you can purchase for $7.50. Wow, that is such a good price. And your money would be going towards autism research. I was reading here what causes autism, how common is autism, what is autism itself, and I highlighted this, which, let me read this paragraph. A small number of cases can be linked to genetic disorders such as Fragile X, tuberous sclerosis, and Angelman's syndrome, as well as exposure to environmental agents such as infectious ones, maternal rubella, or cytomegalovirus, or chemical ones, thalidomide or valproate during pregnancy. Okay, this means the air, quality of air that the fetus is receiving while it's in its mother. The factories that you see around you, what they're putting out in the air matters to your child. Anywho, I looked up maternal rubella, right, on Webster Dictionary, and it says German measles in a pregnant woman that may cause developmental anomalies in the fetus when occurring during the first trimester. So then I looked up German measles. Let's see, let's go. This looks like a legit website. It's the first one on Google, and I'm assuming that's why they filter stuff. 3-day measles, German measles. Rubella is a contagious infection in which there is a rash on the skin. Causes, incidence, and risk factors. The disease is caused by a virus that is spread through the air or by close contact. A person can transmit the disease from 1 week before the rash begins until 1 to 2 weeks after the rash disappears. The disease is less contagious than rubeola, measles. After an infection, people have immunity to the disease for the rest of their lives. In children and adults, rubella is usually mild and may even go unnoticed. Risk factors include not being vaccinated against rubella, exposure to an inactive rubella virus, which I'm pretty sure a lot of us get when we're born. I'm guessing if we have this information. I mean, I'm not a genius on like this type of stuff where it comes on to medicine and rubella viruses and the names and terms. So it could be just a common cold, maybe? Children, not common cold, I'm sorry, but, let's see. Symptoms. Children generally have few symptoms. Adults may experience a fever, headache, general discomfort, and a runny nose before the rash appears. They may not notice the symptoms. Other symptoms may include bruising, which is rare, inflammation of the eyes, bloodshot eyes, muscle or joint pain. Signs and test: nasal and throat swab for viral culture, rubella serology. Treatment: there is no treatment for this disease. Patients can take acetaminophen to reduce fever. Defects that occur with congenital rubella syndrome can be treated. Expectations, prognosis. Rubella is usually a mild infection. However, if a mother is infected during early pregnancy, rubella can cause defects in the developing baby. The unborn baby can develop congenital rubella syndrome, which typically has a poor outcome. Defects are rare if the infection occurs after the 20th week of pregnancy. Complications that can occur in the unborn baby: cataracts, congenital heart defects, congenital rubella syndrome, deafness, ear infection, encephalitis, mental retardation, microcephaly, transient arthritis, common in adolescents and adults with rubella. A miscarriage or a stillbirth may occur. Calling your healthcare provider. Call for an appointment with your healthcare provider if you're a woman of childbearing age and are unsure of whether you have been vaccinated against rubella. You or your child develop a severe headache, stiff neck, earache, or vision problem during or after a case of rubella. You or your child need to receive or immunization vaccine. Okay, prevention. There is a safe and effective vaccine to prevent rubella. The rubella vaccine is recommended for all children. It is routinely given when age are 12 through 15 months old, but is sometimes given earlier during epidemics. A second vaccine booster is routinely given to children 4 to 6 ages. MMR is a combination vaccine that protects against measles, mumps, and rubella. Okay, I thought we did. Women of childbearing age usually have a blood test to see if they have immunity to rubella. If they are not immune, women should avoid getting pregnant 28 days after receiving the vaccine. Those who should not get vaccinated include women who are pregnant, anyone whose immune system is affected by cancer, corticosteroid medications, or radiation treatment. Great care is taken not to give the vaccine to a woman who is already pregnant. However, in the rare instances when pregnant women have been vaccinated, no problems have been detected in the infants. Okay, so we know a little bit more of what maternal rubella, German measles are. German measles, that makes me wonder if somehow, well, you got to think about German and their history and what toxic stuff they were being exposed to. Perhaps some were let go on purpose because it said here, like, where was it? With direct contact. See, this disease is caused by a virus that is spread through the air or by close contact. So, I don't know. You gotta just keep in mind that a lot of the things that happened in our history still affect us today. We're the aftermath of all of this horrible stuff that happened, and people are starting to forget what evil can do to humanity. It is part of our history, and it doesn't mean that it's been defeated. It's just learned how to hide itself within us and confuse minds, and it's the reason why we still have all of these hate crimes going on. Our world is still not perfect. We may have a better type of life now. People like you and I, we didn't grow up around this massive stuff that occurred, like in Germany and even during slaves, and we happened to grow up in a middle class upbringing had a regular house and having to work and going to school and a routine life. That history is affecting us now, so just kind of keep that in mind. Alright.